I'm so glad I get to talk to you because the worst thing that I hate about my own podcast is prefacing when we start talking about like the body or whatever, prefacing, well, I'm not a doctor. Mm-hmm. Now I have a doctor on the podcast and I can just defer to you. So thank you for bringing your expertise on the podcast.
Yeah, absolutely. I'm happy to do it.
And I'm looking forward to hearing from you. I have a few, some friends that are looking forward to hearing from you. After we had talked last weekend, I went on a hike with one of my friends, and I told him that I was interviewing my in-laws' neighbor, and they were like, "Oh yeah, you told me about him. He's a legend. You're a legend." So
it's humbling.
So you're a living legend, and I just want to thank you for being such a great example, and just seeing, and for me hearing from it from afar, third-party objective, right? I'm so excited to see what's going on with you and to learn from you and to hear from you. But before we dive into the nitty-gritty, we were talking before that you're not a Youngstown native.
That's right.
But now you're building a house in Youngstown, so it seems like you're committing to the area. Yeah. What are your thoughts on that? What did your parents say when they Googled Youngstown, Ohio, and saw the Wikipedia page?
Yeah, I think, certainly everybody was pretty agreeable to come here. I think the main motivating factor, like we talked about before, is family, mm-hmm. right? So I think at the end of the day, that determines probably where a lot of people end up living. And thankfully, my career path is compatible with that as well. And so I met my wife, Sarah, when we were in undergrad. I went to Cedarville University, and we graduated there in 2011. And once we met sophomore year there and got married shortly after graduation. And it became pretty clear that we were going to either try to do one of two things, either kind of like somewhere in the middle, go somewhere else, and kind of leave it open to what God had planned for us. And lo and behold, here, like about 10 years later, we're back in Youngstown. She grew up here in the Youngstown area, and I grew up in Michigan, like I mentioned earlier. But it's been good because it's
the
close.
Detroit area, right?
Yeah, a little north of Detroit, about 45 minutes.
So growing up, were you a fan of the Pistons?
Yes, yeah, absolutely.
I mean, the team that they cobbled together, of like a bunch of misfits from all over the place, and then winding up having 5 starters in the Eastern All-Star game. Amazing.
They did it, yeah. So that's definitely one of the things. Growing up doing that. Detroit Tigers, of course, going to some of the hockey games. Yeah. Big Red Wings fan growing up. So
not a lot of hockey here.
Right.
I don't know why, though. I mean, you would think because our how in the world is our mascot a penguin when you guys are more north than us? How does that work?
I don't know. I guess you got to think. I think there are penguins in Antarctica. So, but
Zoe, but there's no penguins here. We don't even have a zoo.
that does beg the question.
I went to Youngstown State, so I can say this, right? I'm allowed to belabor this point. Zoe, sit. This is the first time I've had a dog on the podcast too. Sit down. I just always wondered. I know it's cold here, and we always complain about how cold it is.
Sure.
But we took it to another level of making our city's mascot a penguin, right? Because you got Minneapolis, right? You got Detroit, you got Buffalo. Some of those places are more north than Canada.
This is true.
So how are we the Penguins? I don't know. I have no idea.
That's a toss-up.
Anything that has surprised you from, an outsider's perspective of Youngstown?
Yeah, there's one thing that kind of consistently strikes me as fascinating about this area, and that's everywhere I go outside of Youngstown, you just don't see like one thing in particular as you're driving around. And the one thing that stuck out to me, this ever since I even came and visited my to-be wife when I came here to her town, was the drive-through beer caves.
Oh, okay.
Never had seen those before. That's just not a thing that's around, and so that was just like
That's interesting.
Stuck out to me as like interesting. Why is this here? So
it's been that way my whole life. So
right.
I'm thank you for
so I had
never
never experienced anything like that. But here they are. I have one down the street. So,
and was there a moment? Was it when you were in Michigan, or was it? I would imagine it was when you were in Michigan before going to college. When was there a moment that in your mind it clicked for you that you were going to become a doctor?
Well, it's one of those things, I guess, I've been kind of drawn to from a younger age. I always enjoyed the sciences and kind of even just ecosystems, and then eventually developed an interest in the human body and kind of like understanding what makes us tick and how are we made, how are we created, even designed. And I think that really perked my interest in my like middle school time, and then I also enjoyed like talking to people, doing stuff like this, or just kind of getting to know people, being with friends, and having interactions, and I found a positive way to kind of put those things together. I think medicine does that. I think you get to have really interesting like diagnostic challenges, and you get to really dive into pathophysiology and disease processes. But at the same time, you don't get lost in that, because you have to remember these disease processes are taking place in a human being.
Wow.
So in a person.
It's so crazy, isn't it? It's so crazy, like how vast the human body is.
Yeah.
And like it's doing all these things at once, and we have no idea to do it. Like it was like a thought experiment that I heard someone bring up. They said that you could have a biologist understand how their fingernails grow, right? They understand how the fingernail grows. But just because they understand it, they understand the textbook, doesn't mean that they can grow their nails better than a 3-year-old.
That's it.
And there's innate knowledge that is latent in our bodies it's working at such a high complex level that we just do it naturally.
Yeah.
It's crazy.
It is. When you sit and think about some of the things that have to happen just for us to have this conversation, it's mind-boggling.
Yeah.
So.
It puts a lot of perspective. And one of the things that you said over the weekend was that you had mentioned, and correct me if I'm butchering your term here, but you said that the more and more you get into your practice, you realize how much we don't know.
Yeah, that's absolutely true. I think just with anything, the more you start to learn about something, you realize how much deeper it can go. And then you realize how much more we need to know about it to really have a handle on what's out there. So I think that's probably true. At least in medicine, I know it's true. And I've heard this of similar things with people in different fields.
Oh, yeah.
I'm sure you can attest to that.
Yeah, I've talked about this on the podcast before. My first class at YSU was an economics course. And it was so fascinating to learn how the economic machine works. And I'm learning. And the professor kept, and it was like mind-boggling what I'm learning in microeconomics. And as the professor's like blowing my mind, he's saying, "Oh, well, that's a whole nother course," or "Oh, that's in macroeconomics." And I'm like, "What? I'm barely grasping onto this stuff, and you're telling me that there's like a little part of this that has its own class?" And that's when I realized that there's a term that says as the circle of knowledge, as that gets brighter, it illuminates the vast darkness of your ignorance.
Yeah, that's a great analogy. Yeah.
And to me, that's been the most powerful thing, is just to understand how much I don't know. So has there been anything, in your practice, whether it's recently or just something that you can think of, something that you came across and you're like, whoa?
There's every day there's things that you come across that you're just like, wow, I need to know more about that. And that's I think the challenge, is that as you kind of do things, and that's why they call it practice, is because there is the art of that. You kind of learn certain things with each patient. I think that's what I've come to take away, is like each case, however routine, does bring you some kind of new piece of knowledge. And And I think it gets kind of like it builds your fund of knowledge, and that's where you get experience, and that's where right, experience is important, but it's not the final end all be all for this stuff. But it does certainly give you a certain amount of comfortability, and confidence, I guess, dealing with things. But again, it's one of those things you have to check with current research and that, and go back and look at it. But in particular, I mean, the things that are most fascinating, at least to me right now, partly because personally, but is the treatment of cancer. And I think that's been revolutionizing here in the past 10 years, and it continues to do that. And I think that's amazing what we're capable of doing, and offering different treatments and therapies that are really prolonging somebody's life with which would have been a very devastating diagnosis. Still a devastating diagnosis, but we're getting response to therapy. People are living longer. So,
Steve, I hate to do this. I think we're going to have to pause this because that frog is not going to stop. Are you okay with bringing this inside?
Yeah.
I'm so sorry.
No,
there was so great momentum going. We'll be back. So, Steve, we're back. Thank you. I apologize for that interruption.
No problem.
You had brought up your fascination with the progress that we're having seen in cancer treatment and the prolonging of life. And that's something I do want to touch base on. But one of the things that you said earlier that stuck out to me is how at such a young age you had realized that you did want to become a doctor. And that's not only is it an honorable pursuit, but obviously a challenging one, a very difficult one. So do you have any tips or tricks when it comes to studying, making sure when you're taking on such a big challenge of getting your doctorate degree for young people or just people in general who like to learn? Is there any tips or tricks that you've come across?
I mean, it's a process. I think the biggest thing throughout it all was support systems and finding ways that you can be supported through the process, because it's draining to try to tackle something like that on your own. Partly for me, I mean, we got married right after my undergrad experience, and so then I pursued getting into medical school right after that, and was able to get in. And one of the things I think that was most helpful was we decided to go ahead and get married at that time, knowing that there was many years of potential long hours and maybe moving, being far apart. So it just kind of made sense in our minds. And I think if I'd give anybody any advice, I'd say live now. Knowing that, not in the crazy sense, not go out and party and do that stuff. I mean, within moderation, right? But I do think living now in the sense that don't put your dreams on hold. If you want to be married, if you want to have a family, it may not be financially the best time, but at the same time, there's a lot of factors that go into it. And some of it, I think, is I've learned you just have to make those decisions. And those support systems are really, really helpful as you move through. And I think they help you develop and grow as a human too. You get life experience, and that's something that that's really crucial to being successful as you move through the studying process.
So don't wait for all the pieces to be together to feel like you need to start moving in a certain direction. Just move.
It's tempting to do that. And it's hard, right? So there's a lot that goes into it. I think for me myself, faith's an important part of it. And I think the other part, like I said, is family. And I think moving forward, you got to have your priorities straight. I think that was a couple of my mentors throughout medical school would always go over that with me and some of my colleagues, but they would just remind us of lay out your top 3 priorities. Is it faith, family, and then what else is left? And you got to just remember each day those decisions you're making and reprioritize your day and try to be capitalizing on the time that you have and fitting those things into those priorities in that structure.
Yeah, for sure. Thank you. That's such when you're juggling so many different things and trying to take on this incredible challenge, you have no other choice but to prioritize and execute, right?
Right. Yeah, because you gotta do things. There's going to be tasks you have to accomplish, and trying to find ways to be effective at doing that.
Yeah. Did you? I feel like there are. I don't know. Maybe I'm speaking for myself because it took me such a long time to prioritize things. It wasn't until I met Jess that she really just pounded that into me, like priorities, priorities, priorities. Is there any like framework? Well, I guess you laid out the framework, right? It's like, you got to list out your three. Right. What are your big three, and go from there? I mean, and it feels like the first two are kind of staring right in your face.
Right.
It's like that.
Pretty obvious.
It's like that third one is the key that is the Trinity that pushes everything forward. Okay, got it. So, with taking on this incredible journey of getting a doctorate degree, you're working, you're learning, you're studying, while getting married, while starting a family, and then August 2018, right? So take me there. Take me to you're doing all this. You're doing all this incredible work. You're prioritizing. You're executing. You have a bright future. I don't even think it could get any brighter. And then August 18th or August 2018. What happens?
Yeah. So like you were just saying, Lewis, things really were culminating into like, you've reached the end of your training, right? And you're finally going to be what is called an attending physician, where you're finally not under anybody. You're able to make your own decisions. You're able to you complete your training. Obviously, you're not done learning, but that said, it's a big accomplishment. And so you go through about 10 years of training. And so I had just completed my residency in internal medicine here in Youngstown, and was actually supposed to start work on August 20th, and ended up having a significant health event. I actually had a seizure on the 18th, or on the 15th rather. And so on August 15th, I had a seizure.
So 5 days before you were doctor, right? 5 days before you're running through the banner at the marathon with your hands raised. You have a seizure.
Yeah, it was actually, and it was to make it matters a little more complex. I had my board exam in 2 days. So that was to be board certified in internal medicine. So I'd been studying pretty much endlessly that summer, and then to have it kind of, not only did I not have a summer, but I ended up studying because of studying, but I ended up really having an issue with my health. So having that seizure just without any warning sign, and thankfully, I wasn't, I was not driving or anything like that. I had no idea what was happening. And ended up going to the hospital and getting admitted with a cancer diagnosis. So,
and please help me with this. Alveolar soft part sarcoma. ASPS. That's right. And I had read that ASPS, not only is it just a rare form of cancer, but inside of the sarcoma section of cancer, the percentage of someone getting it is like 0.5% to 1%.
Yeah, you're right. Yeah, it's really rare. About 100 cases diagnosed in the United States annually.
Wow. So, out of 300 million people, 100 people a year.
Yeah.
And you were one of them in 18. Yeah. In 2018.
In 2018, that's right. Yeah. And it's very in some ways it doesn't affect people really older than 31. So I was kind of right at that optimal age of when people start to get that diagnosis. And so in my situation, it's obviously very rare. So we had to undergo a biopsy in that to get diagnosis. Since we're talking, I'll tell you. Originally, I presented with a seizure, and it's very bizarre for a number of reasons because I was admitted to the hospital I'd worked in for over 3 years.
Wow.
And so I know a lot of people that worked there, and that actually turned out to be a huge blessing. Everybody was so compassionate. I mean, everybody rallied really to support myself and my family, my wife and my kids. So that really made a huge impact on us, and in some ways, in God's providence, right? This happened just prior, like a week prior to my seizure. I was out we went vacationed on the Jersey Shore. I was out in the water with my kids. So, I mean, I'm just so thankful God spared me from having the seizure at that time. I could have been just out in the waves. And so instead I was at least on land and had that happen, and was able to kind of quickly at least reach a cause of what happened. Originally, people were thinking, you've been studying hard, and I drank like a ton of coffee that day. So I think a lot of people were thinking, it's probably just stress. That can happen, sure. And then the initial imaging in the ER showed 3 masses in my brain. One up to about 3 centimeters in size, the other 2 a little smaller, but they're in different parts. And so I was admitted then to like the neuro ICU, to intensive care there, and thankfully didn't have any more seizure events after getting some medicines, but ended up having CAT scans done. And after looking back, and answering some of the questions from the doctors that were taking care of me, they had asked me, is anything off, anything different that's been going on? And I had, like, in hindsight, after being told, looks like you have brain metastasis, I was like, I guess my leg has been acting up a little bit, but I'd been a runner. I hadn't really thought much about it. I've always had a little bit of tight IT bands, and so I honestly have been stretching my left leg quite a bit more than my right. And I also hadn't been running that much because I've been studying a lot. So I didn't really put it all together, but looking back now, it's like, boy, like I should have thought more about this. But this was the furthest thing from my mind, to just have my world explode. So then the scans revealed that I did have, they ended up doing scans of my leg, and it showed a large mass, about 8-9 centimeters, in my lateral thigh. And then it had spread to my femur, as well as some spots in my lung. So
unbelievable. Yeah. So when you became coherent and you got the diagnosis, what was the first thought in your mind?
I can't say I had a thought. I'll be honest. It kind of, the analogy that I kept thinking of was, I don't know if you've seen Saving Private Ryan. But when the soldiers hit the beach and the shells are going off, and there's that concept of like shell shock, that's how I felt and that's probably how I stayed for about a week. Like it was just like I could function, I could talk about it, but it was almost like it wasn't talking about me. It was like this out of body experience. Yeah, it really felt dreamlike, to be honest. Some of that I think I can attribute to the medications I was getting. Some of the high dose steroids to calm down brain swelling, and all the new medicines to me. So I think that was a big part initially. So when I was told, I remember the first thing that happened that morning, the morning after my seizure, I woke up and the neurosurgeon came in and he said, you've got brain mets. I'm not going to do anything. I'm not going to go in and do any surgery on this. You need to go somewhere else. And so I was like, okay. And then I was like thinking, brain mets. It's like, how and where? Like it just didn't, I couldn't compete. And then, like I said earlier, I got to thinking about my leg. And then ended up going for a biopsy of that primary tumor on my leg a few days later, and then revealing this diagnosis. So.
If you don't mind sharing, and if it's something that you don't want to share, I completely understand. What was the conversation between you and your wife when you first had the ability to sit down as a couple to talk about it?
To be honest, I don't really remember. I just know that there weren't really words. Like I think we both had an understanding, like we knew what it could mean. Sorry.
No need to apologize. Yeah, don't.
Yeah, I guess I just didn't really. I don't think we really had to communicate much about what it was or what it would mean for us.
And also at the time, you had a young daughter, and then was your son just born, or was he on the way?
He was 2.
Okay, so you had a young daughter and a young boy.
Yeah, or he had just turned 1.
Oh, and he had just turned 1. Mm-hmm. On top of all the other craziness.
Mm-hmm.
Wow.
Yeah.
And it was beyond words. It was beyond just hashing it out and having a conversation.
Yeah, there was nothing really to hash out. I think we were just both. I mean, she was in a state of shell shock just as much, if not more, than me, because we both had a concept of what our future held, and it didn't hold a stage 4 cancer diagnosis. So,
of course.
Yeah.
One of the things that when you were going through this, and when I heard about this, Mike, my father-in-law, one of the things that he pointed out to me that I didn't think of, he's like, he's going through all of this, and he's a doctor, and he's smart, and I know he's studying everything about it. So it's like, not only you have this horrible situation, but you know more about the human body than just the average Joe that gets it. Mm-hmm. So what's that like?
Well, to be honest, I didn't really know, other than that it was bad, exactly what needed to be done. And in fact, without going to subspecialties to get a diagnosis and to figure out how do we treat this, because it is so rare, we had a concept of what it meant. Obviously, you can look in the literature, you can see the outcomes of people with this diagnosis, right? We looked at that stuff. People were more than happy to share it with us, despite us being able to look at it, which is, it all is, people are doing that to be helpful. But in the moment, right, then when your world's falling apart, it was one of those things that it was almost hard to process, and you're thinking there sitting, well, it's not going to happen to me. I won't be one of those statistics, right? What about I know that there's a certain percent, right, that have a 5-year mortality, and maybe I won't be in that maybe I won't be in that percent.
And what is that percent? Because it isn't the recidivism rate? Is that the proper term? I don't think that's the proper term. Remission, right?
For remission.
What is that rate?
So to be honest, there's not really, at least from my understanding, a very because this disease is again so rare, and without it being as prevalent, it's hard to study. And the other thing about it is treatments developed over years. So historically, the 5-year mortality rate was very high. I think primarily because of chemotherapy was the primary agent for treatment, and in general with that and surgical resection. But those treatments in and by themselves didn't lend to a great prognosis. I don't remember the statistic offhand as far as the percentages, but I know they were dismal. They're not what you want when you're 29. So
or 39 or 49 or
exactly.
That was one of the because my father-in-law is a cancer survivor, and I asked him, I was like, what was going through your mind when you were going through chemotherapy and you had cancer? And he said, I just thought I was going to die. And for me, there's been just 1 or 2 moments in my life where in certain accidents where I thought I was going to die, where I thought it was the end. But never in a situation where you're kind of just sitting there looking at the clock, counting the hours of just saying, it's only a matter of time, right? So when you're in that type of place as a person, I mean, what do you do? How do you keep it together?
I think for me, at least, the first thing that came to my mind was, it's almost, I don't necessarily care if I die. It's more about what's going to happen to my family when I do. I think that was the biggest thing that hit me in the hospital. Is I don't want to part with them. I'm not ready. And so the whole idea of being sick, I think, was a very hard one to come to grips with. For me, I mean, it was one of those things like I took care of patients. You know, I've done that. I've watched patients get better. I've watched patients die. You know, I've been the last person that they've seen on this earth.
Oh my goodness.
And so to think about that, and then to think about me as a patient
on the other side of the blanket.
Right. It changes a lot when you can no longer leave the room.
Wow.
So when you're the patient, it's easy, you know, right? You're the one taking care of them. You just go in, you do your thing, and you walk out, right? You go home that night.
Yeah.
But this was a reality. This was going to leave, when I left the hospital, left with me. You know, this isn't something I could just leave there. So,
yeah.
So I think that was a big part of it. Yeah. As far as other things, I don't know. That was kind of the hardest part for me, is coming to grips with what am I leaving behind. And I think, you know, I know you had mentioned like those moments where you feel like, boy, like I could die. You have those like kind of life or death moments at times in life, and thankfully I haven't had that many of them up until this. But even through it, I remember, and my wife I think would say a similar thing, is that I consistently would say, you know, I think this is going to be okay. I really had a sense of peace, and I don't have an explanation for that. It certainly didn't come from me. I think it came from God personally. That He gave a sense of peace. And I think it came from the people that were actively praying and thinking about that. I think that played a role.
Wow.
So
that's very interesting, because as a scientist, right, you have your job really is to look at measurable things, right? But then you go into the realm, you're saying the realm of the spirit realm was what worked. Can you dig deeper onto that?
Yeah, I mean, there's evidence out there. I couldn't quote the study for you, but when I've looked into it, the cancer patients in particular that are faith-based or believe in some faith outside of themselves generally have better outcomes.
Wow.
And whatever that looks like, outcome, you know, in a broad sense. So I kind of knew that going into this, and so I certainly knew I had things on my side, right? There were things in my corner, people in my corner, things in my favor that I knew. Obviously, I didn't know what would happen, right? But I think I'm not going to say accepting, but I think I moved through the stages of grief at different times. And so there's that acceptance phase, there's this denial phase. And I think, you know, coming to that acceptance phase, it took a long time.
Wow.
But it happened at different levels for me, I think, over the past 2 years. But I think right now, if I had to say, I guess as far as the spiritual realm, I think that played a role. Could I tell you exactly what? No. But I do think what did happen is I think God uses modern medicine. I think He uses people. I think He uses doctors. I think He uses nurses, custodial staff, everybody, you know, that I interacted with while I was a patient there to show me something, to teach me something. And so I think that's how it works almost, is that the medicine, right, we do use these therapies, we have these treatments, but I think ultimately, like, in my opinion, from my experience, these things are all derived from our Maker.
So would you say, kind of building off of that, would you say that there was a pre-diagnosis Stephen and a post-diagnosis Stephen? And if so, what's the difference?
Yeah, absolutely. I mean, I think once you go through something like I have, you're not the same. And Sarah and I have definitely, you know, talked about this a lot, and that you're just a different person. And some of that is, I think, like we mentioned earlier, like the idea of life experience, having had to go through hard times. I think obviously you'll learn way more than you would in a hard time than in a quote unquote good time. And maybe the hard times are actually good times, but we just don't want to see it that way. But I would say that's probably one of the things that sticks out the most to me, is that you really do have, I don't know, you learn from your experience. And I think afterwards, looking back now, I would say only in the past few months would I even consider doing a podcast like this.
Wow.
People ask me immediately after my diagnosis to come and share, or 6 months, come and share. And I don't know.
How long have you been in remission?
So I was told in remission April of 2019. So now it's been over a year of remission. And I would say only in the past few months would I even consider talking about it with people in a kind of a public sphere. Partly because I thought it was very personal. And the other part is just I didn't know how to process my emotions. I'm trying to figure out what am I feeling, and I don't know. For me, I'm just not one to put it out there for the world to digest.
So it wasn't a switch. It wasn't okay, I'm in remission. Now business as usual, right? So it's like this thing that happened, and you're still impacted by it, and you're still learning from
Absolutely. it. Yeah, it's one of those things that you just I'm forever going to be learning because of it, and some of it too is because the journey continues, right? So I'm still getting scans and continuing forward. I mean, I'll go into a little bit about the actual treatment that I had to go through, just because that's pertinent. But so I got diagnosed in August. In September, I was recommended and referred to go to Columbus, to Ohio State. So I got treatment at the James, and that's where I still am seen there. So I underwent stereotactic brain radiation. So I did 3 treatments of that prior to having a craniotomy, where they resected the larger of the tumors that was in my skull. And so that all happened in September of 2018. And then I was started within a few weeks after that on a treatment called immunotherapy. I'm on what's called atezolizumab. And so it's an IV infusion that I've gotten since October of 2018 every 3 weeks. So I think last time I just went last week, it was my 27th infusion.
Wow.
So, and so I'll continue on that for a while. And then that, of course, wasn't treatment for for the primary tumor. So the original plan was to go ahead and see how I would respond to the treatment, because again, it was all off-label. People were only getting this drug essentially through the pharmaceutical companies and through clinical trials. And unfortunately, in my case, there was an active trial ongoing, but I was not able to be a part of it based on some I didn't fit some of the criteria for the study. And so based on that, and then the timing also played a role as far as getting me treatment sooner than later. So that was a big part of it. So I was able to thankfully still start on the medication without being in a clinical trial after going through the pharmaceutical industry. So they've really helped me in a lot of ways. They've given me a life-sustaining treatment. So
that's unbelievable.
So there's that. So I stayed on that for a while, and then underwent some surveillance or some follow-up scans to see my response. I had PET scans and more imaging, MRIs of everything, and was able to see that the tumor actually was responding to my treatment, and it seemed to respond very well after about the first 3 or 4 months. So after that, I proceeded on to have limb reconstruction surgery. And so what that involved was they ended up taking the tumor, like I said, was in my thigh, like the lateral part of my thigh. And so they went in and removed that, and also did what's called a vascularized fibular graft. And so they took the fibula out of my left lower leg and the midsection of it, and they took out about a foot of my femur, because there was also disease in my femur. So it had to go as well. And so they put the fibula bone in the place of my femur, along with cadaver bones and a huge nail. And so that was the surgery I underwent in April. And then since having had that resection, they removed all the known tumor on my scan. So I've been in remission since that point.
Oh my gosh. I literally can't believe it. I can't even wrap my head around it.
Yeah, it was a crazy thought process. When I first heard the surgeon describe what the surgery was going to be, I was like, okay, is that real? Is it going to happen?
Just like the guy cutting the grass across the street at this time during the podcast.
Right.
I can't believe it. Really?
Yeah. Yeah. So in that sense, I mean, it was pretty crazy. And so, I mean, the surgeon, right? Everybody down at the James, I mean, just phenomenal people. Just really caring, compassionate. I mean, don't have one bad thing to say. Just all good things there. As far as my experience been, but I think the recovery from that leg surgery was pretty challenging. It was like a 12-hour operation, so
oh my God.
It was a week in the hospital and transfusions and the whole bit. So so there was that. But
and in no way do I want to disrespect what you went through. Just hearing it is making me tired. Just hearing it.
Yeah. So
I can't even imagine, being you or your family going through it.
Yeah.
So how do you? So okay, you get the treatment at the James. It's an ongoing process. It's a still ongoing process. But in the meantime, between, and correct me if I'm wrong on the dates, April 2019 and then now, between that time, you do take your boards. Right? You pass, and now you're a doctor and you're practicing.
Yeah.
So
I've been able
what?
to get back to work and it's kind of surreal. There are days when I'm like, did that happen? That I guess shows that we're getting back into life and learning to live with what happened, and processing it. But
so wait, when did you take the boards?
I took those in August of last year.
So between April coming out of all this craziness and then August,
right?
You put the nail in the coffin when it comes to your getting your credentials. You get what happened in April, between April and August? What is that like?
There was a lot of parts that weren't so great.
Yeah.
But I mean, I had to go through a lot of like physical therapy. Couldn't put any weight on my leg for about 4 weeks, so I lost a significant amount of muscle. So had to start back with a walker and then go to a cane. Had some of my friends rallied around us and they built a ramp.
Year.
Yeah, they built a ramp for my house.
And unfortunately, we don't have the video aspect of it, but you wouldn't tell looking at you now.
Yeah.
It's amazing how far you've come. But I'm sorry.
Oh, yeah.
Through that process.
Yeah.
April, August.
Yeah.
Walk me through. So they get the ramp there. You're building up physically, and you're getting back ready to take the boards again.
Yeah. Yeah, I kind of used the time. Like I wasn't able to do a ton that summer, so I kind of sat and studied. So
that's crazy.
Yeah. But it was, I think it was one of those things that I knew.
That doesn't shock you? That doesn't shock you?
It was, it's one of those things that like I wanted to move on with my life. And I think, the biggest thing is that, life was going to be different, and it still is different, right? I can't say I'm totally back to normal, right? Whatever normal is.
Yeah.
There is no normal in my opinion, but I think, there's some of it that is really crazy. Going back to like what kind of happened, I think probably like in some ways, I guess the surgery and that and all that sounds like a lot to come through. But there's a part of it that like a lot of people I haven't shared as openly about, is that I suffered some pretty severe side effects from my medications initially when I was diagnosed, like in August. And it related to the high dose steroids as well as the seizure medicine, it turned out. But I actually was like, you would call it manic, possibly psychosis, definitely psychosis at times. And so I had like serious irritability, very high anxiety, for a couple months, and it was persistent. I had to see a lot of different doctors for that as well. So that was, if anything, right? So you have, I think the hardest part about this whole thing was I had cancer, but then on top of that, I wasn't myself. My personality changed entirely. I'm usually pretty chill and just kind of go with the flow. I became like super irritable, angry at the drop of a hat, and really unreachable for like processing this. So I think that's where some of the real miracle is that I have my mind back, to be honest.
That's unbelievable. Yeah, I mean, because to go through that turbulence, you need the software, right? You need the most up-to-date software. And it seems like that was even put in a challenging situation.
Yeah, I think if anything, almost that was worse than the actual cancer and going through the surgeries and everything, because I just wasn't myself and there really wasn't anything I could do about it. I knew.
You could just feel it.
I could feel things were off, but I had no impulse control. There were certain things that I just could not do.
Is there any part of, you had talked about acceptance before, was there any part of that on the mental side that helped break through?
Yeah, I think the biggest thing for me too, and like I said, I haven't talked about this with a lot of people until the recent couple months here. I think some of that was like my processing was so delayed. I couldn't really process the diagnosis for really a couple months because of everything that happened with me and the side effects of the medications that causes my mental state to just change, my personality. So it made things really tough. I couldn't really move forward in that state of mind. And so once I was able to identify, and once the doctors identified that was the medications were contributing and my medications were adjusted, then the fog kind of lifted, and then things started to become like, okay, this is real. And because prior to that, it honestly was October. I went from about August to October, where I was essentially living in like a dreamlike kind of state. And that's the only way I can describe
From
it.
August to October.
Yeah, I slept probably 2 to 4 hours a night. That's it.
What?
Yeah, for like months. So it was, and my wife will attest to that.
I should get her on the podcast. How did you do with this?
Yeah.
How did you? Wow, she's a legend. Wow.
Absolutely. Yeah. I think, I mean, she's gone through a lot. But we've done it together with family support. Obviously, I and one of the things I think I struggled with a lot, and even now I still struggle, just like the idea of like the fact that I'm talking, have this ability to discuss what happened in the sense that it's like a past tense, where there's a lot of cancer patients that can't do that. And so I think one of the things I've struggled with, and I continue to struggle with, I'll say, is almost like a survivor's guilt related to a diagnosis of cancer, and the fact that the treatment worked. I'm still here. I can't say I'm back to 100%, but essentially, I'm doing everything that I want to do, and it's truly a miracle. But I've really struggled with that idea. And
is it like a why me? Why did I make it out? Not
I think in some ways there is, but I think that's a big part of it. I did struggle with that question, but ultimately it came back to why not me? And so there's really at the end of the day, I've kind of come to realize that we don't have control over this.
Wow.
Right? I don't have control over what happens to this person's cancer or my cancer. It's in some ways they're equal. I didn't know what the outcome was going to be, and certainly I don't know the outcome of other people's. But what I have learned through that is just to be humble when you're talking about that kind of stuff with people, because even people that have had cancer or know somebody that's going through it, they're all at different stages of processing it. And so I think that's what I've learned is like when you talk about this with people, you got to be understanding. You got to let them speak, let them explain where they're at and why, and then try to understand that perspective. So
I hate to bet. That's such a huge revelation, right? Of this idea of, I think I was reading a quote. It was How to Win Friends and Influence People. The author said, you need to listen to people. Listen to what they say. Don't wait to think about what they said. Just listen to what they're saying.
Right.
I don't know if that makes any sense.
Yeah.
But it seems like that's on the same lines, but just specifically with people that are going through a challenging situation.
Yeah, you have to understand where they're at, right? And you can't know unless you ask. So that's I think the hard part is there's a lot of people that would kind of not want to ask, right? And I think it comes from a place of respect. I don't think it's they want to respect your privacy, right? But it meant a lot when people would ask, and I think that's important to do because rather than there are other people that would just say, here's what I think about it, and you're like, well, I didn't ask you, and I don't really care, So and that's kind of what I've had to arrive at the end of the day, right? There are certain people that just don't seem to grasp that concept that listening is very important.
Oh yeah.
And that way you understand the framework for how your relationship is, and that's how you're going to move forward. So I think that's pretty critical. That's one of the things I've taken away from this.
So sorry to backtrack on this. That's such a great lesson. To backtrack on the mental health side of things, you had brought up medication and symptoms of psychosis. I was listening to a neuroscientist who gave a great example, and it kind of lined up with some of my own personal experiences that really brought it home for me. But one of the things that he said was, we look at homeless people walking around downtown or wherever, and they're talking to themselves. And we kind of look at them like, oh my God, this person's crazy or whatever. And he's like, when you look at it neurochemically, there's only a few tweaks of the dials between your brain and their brain, because when you're walking down the street, there's words bouncing around in your head. You just have the circuitry where it's not coming out. And there's only a few tweaks of the dial where that circuitry is you ending up speaking out loud.
Yeah.
And when he said that, aligning with some of my own personal experiences, I look at homeless people like, oh, I see you. Like I see, or not all homeless people look at this, but I've never looked at a quote unquote crazy person the same way, because just looking at where they're at, it's not really that far from me, and it could be just it could be a substance, it could be a stressor on the brain that, just neurochemically changes inside of you, and you could end up that way.
Yeah, I think it's a sobering reality, right? I think we have a tendency as human beings to compartmentalize, and it becomes almost like an us versus them. It's like, well, that couldn't happen to me. You know what I mean? Like that, I wouldn't end up like that. Like, look at me, Yeah. And then you realize, like you just said, you're a few tweaks away, right? Yeah. It really wouldn't take much, And you think about what some people have to go through. I mean, the different patients I've taken care of. I mean, it's phenomenal what people have had to experience, the trauma, the injury, just the experiences. I mean, you can't even begin to understand the depth and the injury that goes into that. So it only makes sense that this would manifest itself like that.
Wow.
There's really that's just how we're wired, in some ways. And so that said, right, that could be us, that could be me, that could be you, that could be anybody. And it was me,
Wow.
It was me. I didn't have any impulse control. There are a number of instances where I said things that I would never say, in large groups or with people. And looking back, some of that stuff, you can joke about, it's funny. Of course, now that I have my mind, right? Yeah. But in the moment, like it's given me a whole new appreciation for the way I see a patient who has any mental health problem. I mean, I think it really plays a role into looking at that with a whole new mindset.
So, can you bring us to the other side of the blanket? That's the way I want to phrase it, because you're laying down with the diagnosis, looking up, right? Well, before and after, you were looking at people on the bed, and then you got in the bed, and then now you're out of the bed and looking at people in the bed. What is that like?
So it's been hard going. When I first went back to work, there were some cases that like would just eat me up inside. And some of that had to do with how close they were to like what I had gone through. And so I had like these like visceral experiences like that would just really hits you in the gut, like these cases it's almost too close to home, but I think moving through that, I have learned like what it means to be a patient.
Wow.
And knowing having that idea that like you don't really know what they're writing about you in the chart. You don't really know what test they're ordering or why they're ordering it.
Yes.
Always. I had a decent idea, probably more than the average patient. But I think that's one of the things that stuck out to me as far as taking care and looking at patients now as I practice is looking at them as humans. I think that's the biggest thing. And knowing that they're there, they have a problem. And they're looking for some kind of solution, some kind of treatment, or a diagnosis, perhaps that would explain what's going on in their life. And so that's what our job is. So,
Steve, what are you looking forward to the most?
I think going forward, I'm excited to see where things go with my career. Obviously, I would have never known that this would even be a part of it. But I think at first I was like, this devastated my life. Yeah. Right? How am I ever going to bounce back? But I think it's changed me in so many ways. It's made me unique, to say, not that I wasn't unique before, but maybe more unique perhaps. And so that said, I think, moving forward, having a perspective, and one of the things that I like to say is, having hope but tempering it with reality.
Wow.
That's kind of the quote that I've kind of come up with is hope tempered by reality. And so it's knowing, right, eventually I'm going to die, right? We all know that. Yeah. But I lived it. Yeah. I lived that this could happen and it will happen. And it probably looked like it was going to happen pretty soon, Yeah. And so that said, I think having been faced with mortality like earlier in life has in some ways changed my perspective on a lot of stuff. I've learned not to sweat the little things. And that's hard to do even for myself now, right? You still get frustrated. Do I still get mad? Yes. Do I still get upset about stuff? Yeah. Yes. But I've also learned to treasure the things that you do have, right? And I think it's easy for us, especially as we're like up and coming into our careers, to get caught up in the whole idea of like, what am I going to do next? What's next? What's next? And I've learned to just take a breath and live in the moment. And I think you just have to take inventory of where you're at and just say, you know what, this is good. And I'm content. And I think that's where I've had to learn contentment and come into the end. At the end of the day, it's like, I'm here. I wake up. I have more things in my life than so many people, right? I have so much to be thankful for. So I think just taking inventory and being thankful gives perspective to each day. So.
Doc, this has given a lot of perspective. Thank you so much. Yeah. You're an inspiration. You're a legend. Your whole family's legendary. I mean, to deal with this and go through it, I can't imagine. Yeah. I was going to ask you if you could put anything on a billboard, what would you put on? I feel like is it hope tempered by reality?
Yeah, I think that's what I would pick. Yeah. Yep.
Is there any, before I let you get back to your family, you've been so generous with your time. Is there anything that I didn't ask you that I should have asked you?
No, I think you hit on some of the high points. I mean, I think this is an experience that everyone's going to deal with differently, and so I think at least the patients that I've come across and from my own experience now, people are going to cope with things in different ways, and you got to let people do that. Obviously, you don't want to allow them to be dangerous about the way they're doing that, but you have to allow people space. But then you have to find ways to support them. And so I think that's where the whole concept of listening comes in. So I think everybody listening to this, everybody that I'm going to interact with is going to know people that get sick. Right? We're all going to know family members that pass away. We're all going to go to funerals. Yeah. So I think the biggest thing that I've learned is just to be still and be calm. One of the things, I guess, to end to one of the I read the Bible a pretty significant amount during this time. And the one verse that sticks out to me is "Be still and know that I am God."
Ooh, yes.
It's Psalm. Gosh, now I'm going to blank on that.
No.
Psalm 46:10, and so it's one of those things that, like, it's that whole concept of just thinking about, here I am. I'm here in this moment. What can I do? Not thinking about yesterday, not thinking about tomorrow. Here we are.
I'm so thankful. I'm so thankful for you. I'm thankful for your time.
Yeah.
We're all growing. We're all learning. I know there's still going to be so much that comes your way. Hopefully, sometime down in the future, we could talk about medicine. I want to pick your brain about what you're seeing, some of the innovations that when it comes to not only treatment, but longevity. And then also want to pick your brain about running, too. I've just started to get into running. Okay. So we'll have to save that for another time. Sure. I'm going to let you get back to your family. Thank you so much. And if people want to find you, I'm not going to send them anywhere because I feel like I did some research on you and you're pretty low key. You're pretty low profile. And I think you want to keep it that way. Is that true?
Well, for now, I'm not opposed to talking to people. It's one of those things, though. Yeah, I'm not necessarily a public figure in that sense, but I'm open to discussion.
Cool.
So, yeah.
Well, thank you so much. I think that does it.
Cool.
So bye, everyone. Talk soon.